In my previous video, I went over how to start a home care agency and briefly touched on non-medical and medical models for home care. In today's video, I will discuss both types, the pros and cons, and who should start either of these agencies. I'll also cover how we can help you on your founder's journey of starting your own agency. On this channel, we cover how to start, grow, and sell healthcare companies. Welcome to Passive Workforce. When thinking of home health care, there are about 4 services to consider: companion care, personal care, skilled services, and hospice care. The most basic form of home care starts with companion care. One of our basic needs as people is social interaction and companionship. That doesn't change when we get older. It's just as important for the elderly, yet harder to achieve as activities to maintain a normal life are not as easy. That's what companion care is for. Companion care provides companionship and non-medical services. These services may include providing company for appointments or running errands, planning, preparing, and cleaning up meals, cleaning, organizing, dusting, and other light household cleaning tasks, washing, drying, ironing, folding, and putting away clothes and linens, hanging out around the house, doing normal things like playing dominoes, chatting, or other games. The main thing that makes companion care the most basic form of home care is that there is no training required for the companion, and there should be no medical care being provided to the client that you're treating. The type of patient that pursues companion care is usually someone who has a change in kind of status. Either they've lost a partner or they developed a new illness that kind of keeps them at home and not able to really live independently. This audience tends to start looking at companion care to fill the gaps that have been created by their physical changes or by the change in their kind of social environment. Oftentimes, the services may actually be started by a child of this person that needs the companion care. Now, the type of person that should go into starting a companion care agency is someone who really cares about the sort of services that are being delivered to seniors. Obviously, everybody who's in the home care space should be concerned with this, but companion care tends to skew more so towards caring for the elderly, and the other services can really be age agnostic. But people that I see that are owners and operators that really have the knack for companion care are people who have either gone through the process themselves with their family and felt that the agencies weren't providing the right type of caregivers, or people who have spent their life's work working with the elderly community. This may be nurses who have worked in the geriatric setting. This may be social workers, or even other aides who see that they could actually do a better job than the agencies that they worked for. So if you're one of these type of people, starting a companion care agency might be best for you. Another thing that's kind of cool about companion care is that in most states, companion care is not licensed. Since there is no hands-on care and there's really almost no risk to the patient, the way that it's kind of perceived is as if it's a private service that the state and the Department of Health doesn't have to get involved in. So if you're someone who really doesn't want heavy regulation and don't want to go through the hoops and circles of getting licensed, companion care might be the place for you to start. For example, in New York, companion care is not licensed. However, personal care, a more advanced version of non-medical home care, is licensed. And from time to time, that licensure is closed. Just now, they re-announced that they're opening licensure for these types of agencies, and we're going to be helping people start these types of agencies. But in New York, the only way into home care for quite a few years was through companion care. So in a lot of states, you might see those ebbs and flows with changing regulation, and companion care might be the only way for you to start in the business when licenses aren't being issued. Remember, with companion care, you're mostly dealing with a private pay audience. You'll be responsible to market, collect payment, and manage employee payroll. The next step up in home care services is personal care. Like companion care, personal care is not considered a skilled service and does not fall into the category of medical home care. Personal care aides can provide all the services of a companion caregiver in addition to hands-on care. Hands-on care includes bathing or showering, toileting, oral hygiene, feeding, dressing, and incontinence care. The key difference is that in personal care, the caregiver's care routine involves making contact with the patient. Oftentimes, at this level is when an agency needs to be licensed by the state. For those of you who are interested in getting into personal care, remember in most states, probably about 90% of the states, you're going to have to be licensed. And that's where things start to get a little more complicated. With licensure comes having to maintain policy and procedures and state oversight, which may include having to be accredited, having to be surveyed every 2 to 3 years. And it's going to put a higher level of responsibility on you, again, because you're starting to provide hands-on services. This is where people can actually get hurt, both your caregivers and your employees. This is where malpractice may start to creep in if things aren't being managed properly. So if you're thinking about getting involved into personal care, you have to kind of think that there's going to be more responsibility placed on you, and you need to be ready and willing to accept that. I think personal care is really great for nurse founders because they have the skill sets to assess the patients, to manage the care plans, and ensure that the patient services are being provided according to the physician's plan of care and according to the care plan that they've crafted. Now, excelling in the personal care space can be a challenge because you're going to have to decide, are you going to work with insurance payers like managed long-term care, Medicaid, and some of the other Department of Social services, as well as working with private insurance that may cover these home care services. And with that, again, comes more oversight, more regulation, more evolved processes that your organization is going to need to have. And you're probably going to need some guidance and help making sure that you are compliant with the state regs so you don't lose your licensure. The cool thing about being licensed in home care is that once you're starting to deal with insurance payers, and this could even apply to the private pay audience that has private long-term care insurance, most of those insurance carriers are going to want you to be licensed in that state if that state is a license-bearing state. So if you're in Michigan, which doesn't have a license, they may require you to be accredited by CHAP, ACHC, or one of JACO, or one of the accreditation bodies that will kind of anoint you as being compliant before they will allow their patients to be serviced by you. So again, if you're thinking about getting into billing insurance or the state-sponsored programs, you're probably going to have to go the licensure route and pursue a personal care license. So to be clear, the two non-skilled services are companion services and personal care services. Let me know in the comment section below if you have any questions. Also, if you're finding this information really helpful, subscribe to the channel as we cover tons of useful information for healthcare entrepreneurship. The next set of agencies fall into the skilled category because, as the name implies, the care that is being provided is of a skilled nature. When talking about skilled agencies, these are typically what are referred to as Medicare agencies because the agency can bill Medicare. The type of people that should start a skilled home care agency, in my opinion, are people who are nurses that are already familiar with skilled home care, as well as therapists. This could be physical therapists, occupational therapists, speech therapists, because for the most part, in the skilled world, it's going to be skilled nursing that's being delivered, as well as the therapies. So having a founder who understands the home care space, who's already worked in home care and has that skill set, allows them to more or less operate seamlessly within that space. Someone who has no experience at all in personal care or even companion care may find the jump into skilled home care to be quite difficult. It's a lot of moving parts. And again, it's a step up in how much contact and how much risk there is to the patient. So if you don't really understand healthcare from a practitioner standpoint, you might be doing yourself a disservice because you're not going to be able to screen the talent appropriately. You're not going to be able to care for that patient appropriately. And these patients are in more need of services. A lot of the people who are going into skilled services had just had an acute event. They're coming out of the hospital. They just had surgery. They just had a heart attack. And the hospital has stabilized them. But now it's time for their treatment to continue at home. And that's going to be of a skilled nature. Now, from what I understand, in almost every state, skilled services are licensed. There are a few states that are not regulated. But the main thing, again, is that those states that are not regulated and allowing you to provide skilled services, you're not going to be able to get reimbursement from any of the commercial payers or Medicare without being credentialed and accredited by a JACO, CHAP, ACHC. So even if you're like, hey, I'm in a state that doesn't require regulations and I'm not a nurse or a physical therapist, I'm going to start one of these agencies. You might have a hard time getting through the accreditation process. Now, the starting of a skilled home care agency, which I've gone through, is quite robust. We worked with a consulting firm to get it started because the policies are more in depth than in personal care. The accreditation process is a lot more complex than it is in personal care. And I didn't want to waste my time trying to figure that out on my own. And we actually don't help people get started in skilled services. We actually partnered with the consultants that worked with our agency, and they're a good operation. They'll get you started the right way. But again, I stress that if you're someone who isn't familiar with the skilled world, it might be above your head to get started in the skilled space. Another thing that I want to advise is that skilled home care is alluring because the reimbursement rates per visit can appear to be high, like $160 or $150 for a nursing visit. Meanwhile, the nurse may only be getting paid $40 or $50 for that visit. So it seems like you're making a ton of money. However, those patients aren't on service for a long duration. The services in skilled home care are typically episodic, meaning that they could be 30 days and 60-day admissions. And at the end of that time period, they've recovered and moved on. So you constantly have to be on the go to keep your census high, keep the referrals coming in. And that's not an easy feat. Compared to companion care and non-skilled care, where those patients may be with you for life, 8 years, 10 years, 15 years at a time, once you've admitted them, they are more sticky clients than the skilled side. So again, you have to really know what you're getting into when you get into skilled and love what you're doing. The last home care agency type I want to discuss is hospice. Hospice is essentially end-of-life care for people who are deemed terminal and need services to maintain dignity and comfort in their final days. Hospice is one of the tracks in home care that I personally hadn't worked in or owned in, and my director of nursing has. And what I understand about hospice is that for the most part, getting licensure for hospice is really limited. In most states, it's only available by certificate of need. And the way that you manage the cash in hospice is on a capitated level, meaning you're going to receive a certain amount of funds for each person that is on your census. And the expectation is that those people are terminal and to fall off of services within a short period of time. So you're reimbursed at what your average load is. And if you don't manage who you admit into your hospice services, you might run the risk of having a major penalty where you've been reimbursed too much because that life has been under management in hospice for too long. Again, it's a little bit of a tricky space. It's not a space that I know really well, but for you to go into hospice, you need to understand the hospice industry, what's considered terminal, what sort of patients you should be admitting into hospice, and whether or not you're in an area that is in a region that is considered eligible for getting a certificate of need approved so that you could get a license. Again, hospice is kind of different in all regards to the other home care services that I described. The thing that kind of keeps them in the home care world is that hospice services are usually administered in the home of the patient, where there's a nurse and caregivers going there to treat them in their final days. And that's why I included it in the world of home care and put it into the skilled category, because there's going to be medication distributions and hand-on care as well. Again, somebody who's terminal might be completely incontinent, total care client in their last days, and somebody has to be there for them. To wrap this video up, here's what I recommend. Evaluate your experience and desire to pursue any of these agency types. You can make money in each of these areas. However, skilled services tend to be short-term, while non-skilled services tend to be for a long-term duration. As the skill level increases, so does the complexity of getting a license and meeting regulations. With that, of course, comes increased startup cost. If you need help trying to navigate starting one of these businesses, feel free to schedule a consultation and make an appointment with one of the people on our team so that we can put you on the right track, or even get you started depending on where you're located and what type of agency you decide on. Thanks for joining us at Passive Workforce. Like, subscribe, and remember, We're here to help you in the ways I wish I was helped when I first started my business. Until the next one, take care.